My name is Dr. Jeffrey Jenkins, and I'm one of the pulmonologists here at King's Daughters. The pulmonologists have some role in the treatment of lung cancer, but our big role in it is the diagnosis of lung cancer. Someone has a chest x-ray or CT scan performed for some reason. They have a nodule or a mass, some abnormality found on the chest x-ray or CT scan. And then they come to us. I would say most people I see for lung cancer initially come to me without a diagnosis yet, no biopsy performed yet. We do have a weekly thoracic tumor board, which is a meeting where all of the relevant specialties that treat and diagnose lung cancer come together. And people there include us, the pulmonologists, the cardiothoracic surgeons, oncologists, radiation oncologists. So those are the people who are involved on the treatment and clinical diagnosis side, but also some of our specialists who help interpret imaging and biopsy, so the radiologists and pathologists. So everyone who is needed to help make a group decision on how to proceed with lung cancer diagnosis and treatment is there. Certainly the best thing is avoiding smoking or stopping smoking. After several years of not smoking, your risk of lung cancer never goes to that of someone who has never smoked. You always have an elevated risk of lung cancer, but after several years, the risk of lung cancer gets pretty close to that of a non-smoker. So your risk of lung cancer drops off pretty dramatically in the first 5 to 10 years after stopping smoking. There's been a big increase in the early detection of lung cancer. Because of low-dose CT scans that we do to screen for lung cancer, where people who have smoked for a long time and meet certain criteria get a CT scan even without symptoms. One thing that really makes lung cancer such a dangerous cancer is that initially in the early stages, you don't have symptoms. That's why it's important to get the low-dose CT scan before you have symptoms. Early detection is the best way that, if you do have lung cancer, to avoid serious complications and death from it. You should talk to your either your primary care doctor or come to the lung clinic and see us here, and we'll talk about doing the low-dose CT scans to monitor for lung cancer and try to catch it early.